Welcome to chapter 29. We're going to be reviewing pediatric musculoskeletal or articular dysfunction. And this is just going to be the overview. And then there'll be another 2 or 3 lectures going over the different disorders. The overview of the musculoskeletal system. So the components, we have our bones connected to joints, our joints stabilized by ligaments, muscles attached to bones by tendons, and cartilage is the cushion of the joints and supports bone growth. The primary functions provide structural support and maintains body shape. It also protects vital organs, like our skull protects our brain, our ribs protect our heart and lungs, and enables movement through coordination of action of bones, muscles, and joints. Physiological functions. Hematopoiesis is the blood cell production that occurs in our bone marrow. It acts as a mineral reservoir, primarily calcium and phosphorus. It regulates bone reabsorption and formation to maintain strength and mineral balance. And it contributes to endocrine and hormonal regulation, affecting growth and metabolism. We have 5 different classifications of bones. So the human skeleton has 206 bones. They can be classified into 5 categories based on their shape. So we have long bones, characterized by a central shaft called the diaphysis and 2 widened ends called the epiphyseals. And we know that epiphyseals are our growth plates. Some examples of these bones would be our femurs, our humerus, and our tibia. Their function primarily is for support and movement. Or short bones, which is composed of kind of a spongy bone covered by a thin layer of compact bone. This would be our wrist bones, our carpals, and our tarsals, which are our ankle bones. They provide stability and some movement. We have flat bones, which consist of 2 layers of compact bone separated by a layer of callus bone. This would be our pelvis, our skull, our sternum, our ribs, our vertebra, and our scapula. These provide protection and broad surfaces for muscles to attach. We have irregular bones, which are complex shapes that really do not fit into any of the other categories. They vary in shape and size, and these are kind of our mandibles, our sacrum, and some bones with our inner ears. They serve as a specialized function based on their location. And then we also has a sesamoid bone, which is round oval bones. An example of that would be your patella, which protects tendons from stress and wear. Understanding bone classification is important for our nursing assessments, especially when we're caring for patients with musculoskeletal conditions or injuries, as different bone types have varying healing rates and associated complications. Articular system. So the articular system consists of the joints between the bones. Joints are composed of connective tissues and serve to connect 2 or more bones, provide stability and support, allow for movement in varying degrees. Classification of joints is based on structure, function, and type of movement they permit. Clinical considerations, joint swelling and decreased function requires evaluation. It may be due to trauma, infection, or arthritis. Children with neuromuscular disorders may present with defective or abnormal joint development, such as those children with spina bifida. The musculoskeletal system includes the muscular system and the skeletal system. Muscles help stabilize joints and maintain contact between those articulating surfaces. Joints are further stabilized by overlying tendons and ligaments. So the muscular system. Tendons attach skeletal muscle to bone. Muscle shape and joint attachment determine the range and type of movement. Skeletal muscles are voluntary and produce movement by contraction. Muscle disorders in children may present muscle weakness, spasticity, myalgia, myoclonus. Skeletal system is ligaments connect adjacent bones. There's cartilage, which supports the bones. It's compressed and resistant tensions. The fetal skeletal forms initially from cartilage, and then ossification, the process by which cartilage is converted to bone, occurs progressively as the child grows. Growth and motor development assessment. So we want to look at the height and the weight. We want to weigh and measure length or height at every visit. Plot measurements accurately and consistently on our growth charts. Identify deviations from expected growth patterns early. Gross motor milestone awareness. Understanding age-appropriate motor milestones is essential. Delays or failure to meet milestones could indicate hypotonia, cerebral palsy, or neuromuscular disorders. Clinical importance. Early identification leads to timely referrals, early intervention services, which will then lead to improved long-term functional outcomes. Diagnostics. So we can use an X-ray, which will visualize bone structure, alignment, fractures, growth plate injuries. Ultrasounds are useful in infants and soft tissue evaluations. It's commonly used for developmental dysplasia of the hips. CAT scans provide cross-sectional imaging, useful for complex fracture and good bone detail. MRIs are excellent for soft tissue, cartilage, ligaments, tendons, and marrow, and they provide little to no radiation exposure. Bone scans detect inflammation, infection, stress, and bone tumors. Arthrographies are contrast studies used to assess joint abnormalities and cartilage defects. Arthroscopy is the direct visualization of the interior of the joint via small scope. It can be diagnostic, but it also can be therapeutic. Laboratory studies used in musculoskeletal disorders. We can do a C-reactive protein, which is a CRP. This appears in the blood in response to inflammation. It's kind of a non-specific indicator. A positive result indicates inflammatory activity. We can use an erythrosedimentation rate, which measures the rate of erythrocytes settle in unclotted blood. Elevated ESR suggests inflammation or tissue necrosis. Alkaline phosphatase is an enzyme found in the blood, liver, placenta, and kidney. Levels may be elevated in bone disease, fracture, trauma, liver disease, but it also can be elevated in periods of rapid bone growth that we commonly see in childhood. We can do a CPK, which is the enzyme located in the skeletal muscle and the cardiac muscle. Elevated levels could be muscle trauma, muscular dystrophy, also a myocardial infarction. And then we can do a rheumatoid factor, which is autoantibodies associated with rheumatoid arthritis. Positive RF plus elevated CRP plus elevated ESR may indicate pediatric arthritis. However, RF is positive in less than 10% of affected children. So ossification, infants' bones are approximately 65% ossified by age 8 months. And we're going to talk about ossification more on the next slide. Periosteum strength. The periosteum in children is stronger than in adults. Growth and healing. Growth on long bones occurs at the epiphyseals. Rapid healing, growing bones heal quickly. Internal fixation and fractures is often unnecessary. Fractures usual in infants under 1 year due to large force required to break their bones. Usually fractures in infant is indicated of a non-accidental trauma or an underlying health issue. So again, fractures are not something that's common in children because it requires a large force to break those bones. And that has to deal with the fact that the periosteum is stronger in children than in adults. Cranial sutures. Sutures of the cranium fuse between 12 to 18 months. Increased intracranial pressure can separate these sutures, leading to head enlargement. Muscle development. Muscle tissue is nearly fully developed at birth, with growth occurring in size rather than in number of muscle fibers. Postural changes. Development of cervical curve occurs within the first months. The lumbar curve develops fully by 8 to 10 years, indicating musculoskeletal and neurological development. Soft tissue resilience. Children's soft tissues are resilient, making dislocations and sprains less common than in adults. So, pediatric bone development and ossification. Bone number changes with age. Newborns are born with more bones than adult. Many cranial and small bones fuse during infancy and childhood, and that final skeleton is around 206. The ossification process. The newborn skeleton is not fully ossified at birth. Ossification continues throughout childhood as bones lengthen and harden. Growth and cushioning. Epiphyseal growth plates allow longitudinal bones to grow. They're vulnerable to injury, especially in children. Articulating cartilage absorbs shocks and protects joint surfaces from injury. Types of ossification. We have intramembrane ossification, which bone develops directly from connective tissue. This forms flat bones, such as the skull, or endochondral ossification, where bone replaces cartilage, and that's responsible for our long bone growth, like our femurs. And that is the end of musculoskeletal system overview. Next, we'll get into some pediatric skeletal disorders.